And we're going to do the patellar dislocation tests. So from here, we want to have a look at the relax your legs. Should I go jelly? Good. Okay, so there's the kneecaps right here and here. And all we want to see here is we're observing to see when she contracts her quad, do the kneecaps go up and a little bit laterally, or do they jump laterally? So is it a nice, smooth, gradual, slight lateral deviation, or does it deviate laterally right away? If it does, it just means the lateral quad is really pulling hard and yanking the kneecap over. So what we do is I usually put my fingers around them to feel what's going on. Just relax your legs as much as you can there. And then just slowly contract your quads there. Tighten, tighten. Good, and then back down, relax totally. So I want you to go boom, and then contract. Go. Tighten, good. And then go. And relax this left one here. Let it drop. Good, go. Good. Looks like this one actually moves a bit more and almost goes a little bit more that way. But again, you'll just look, and you can see, I'm not going around the front to do it because you guys won't be able to see, but what you do is you just look at which way the kneecap goes. Okay? Next up, you observe for swelling, right? So if they've had a dislocation, where are you going to see the swelling on this person?
Medial.
Medial side of the knee, right? Because that's where they tear the medial retinaculum. So is there swelling here? Is it tender to touch right beside the kneecap on the inside? Okay. Next up, we do the apprehension test. So what that is I just usually get my hands like a diamond shape, put it on top of the kneecap, grab the kneecap, and I push it one way, and I just see the look, so I'm pushing medially, so that means it's probably not going to be a problem, right? Because people usually dislocate laterally. And then I pull laterally, and I go as far as I can with the kneecap. Now, if her eyes start popping open, she grabs my hand, her legs start contracting, she goes, whoa, that doesn't feel good, it feels like it's going to pop off again. That's a positive apprehension sign. She's getting apprehensive about me pulling it that way. Okay? So my thumbs are here at the bottom to catch it so it doesn't pop right off the cliff, right? So you just make sure you glide. Do you feel like it goes further? Is there more laxity? Is there apprehension on behalf of the patient? Okay? So that's your apprehension test. Next, if you look on the next page with the patellofemoral pain syndrome, observation. So observation, we look at now the vastus medialis obliquus. So this medial knee muscle here. So what I'm going to get you to do is squeeze both quads really tight, toes back towards you, tighten, 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 push your knee down. Good. And so we look here. First you observe. You could use a tape measure around there and just measure to see is there a difference in girth or size. And then I would just palpate both sides to see if there was equal consistency. So is one side really mushy and the other side strong and firm, or vice versa? Okay? And relax. And then from there, we have the range of motion. So what would I do for range of motion and weight bearing for this person? What are we looking for? So I'm weight bearing right now. What do I do? She's got knee pain. Range of motion at the knee. What's the range of motion at the knee?
Squat.
Squat. Single leg, stand, bend. What are we looking for with that? When you bend the knee? Pain. Pain and what else?
Does it deviate?
Does it deviate? Usually which way is it going to deviate if it does? Inside, right? What's that called? What's this position of the knee? Valgus, right? Do they cave into that valgus? Does their hip go into internal rotation? Does their foot pronate, right? So you guys have done all of those things so far, right? So next we go into the hip and look more at that. So, and then non-weight bearing, lie flat on your back. So in a non-weight bearing position, what we do is we just bend the knee up and down. Usually I just feel on the kneecap. And really you're just feeling for and hearing for clicking, clunking. Clicking is usually just the kneecap. When there's an imbalance, it kind of glides up the side of the joint and then clicks and goes right back to the middle. And then back again, slides up the side, click, and recenters itself. Okay, so that's usually the clicking you hear. And then lastly, you can sit up again. What you want to do here is you want to do what's called the grind test. Even healthy knees don't like the grind test. What you do is you get your fingers in like a C-shaped position here. I get to the top there, relax your leg. And I slide the kneecap down like that. And I'll get you to just tighten your quads slowly. Go, 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 tighten, 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 tighten. And usually doesn't feel good. I just smush the kneecap against the femur and you kind of grind it across to see if it's irritable on the underside. Okay? So that's that one. And then the last thing, we've determined it's not a patellar dislocation or subluxation. So what we do is we push the kneecap out and I put my fingers underneath there and I palpate the underside of the kneecap. Or I push the kneecap the other way and palpate the lateral underside of the kneecap. Okay? I'm just looking for pain. That's it. Okay, try that.